Let's welcome on board now Vishal Bali, the Executive Chairman at AHH, joining in on the show right now. Vishal, good to have you on the show. Let's first start with what's happening within the hospital space and how, post-COVID, a lot has changed with digital as well as high-cost savings. Help us understand what's been your observation on how the post-COVID world is now looking for the hospital sector.
So I think, while COVID has been a big negative situation for the world on account of what it has done to the world, but I think from an India healthcare perspective and from a healthcare context perspective, COVID has actually put healthcare at the forefront. Healthcare reform, healthcare accessibility, healthcare infrastructure, healthcare funding, everything that for a very long period of time was happening in bits and pieces. COVID has actually, put all of that in front of, in front of governments on the public healthcare spending side, and also equally in front of the private healthcare side. I think COVID has also created a big opportunity, particularly from an India context. As we all know, that India for a long period of time has underspent on healthcare. India's healthcare infrastructure, demand-supply gap is an area which everybody has always been concerned about. But in spite of that, the public healthcare spending in India has continuously been less than 1%, which effectively means that we have done very little in terms of creating excellent infrastructure in this country. We've done very little in terms of medical education and therefore graduating more doctors and nurses. We've done very little in terms of how the overall healthcare ecosystem, from a third-party payer mechanism perspective, will also become very robust financially. So I think COVID has sort of done all of this favor to the Indian healthcare ecosystem by bringing it to the forefront, having this dialogue. And therefore, when you now today talk about the situation post-COVID to every healthcare provider group in this country, you will see them having pivoted a lot in a very short period of time, which I think from a consumer perspective is a big upside, because every healthcare provider today is thinking differently around their services, is thinking differently around reaching the last mile consumer, is thinking differently about the entire digital impact on healthcare, which net is all going to contribute into better healthcare services for the consumer.
Sure. Also wanted you to tell us about what's happening, when it comes to consolidation within the sector. One has seen that over the last 5 to 6 months. Then, of course, there are changes when it comes to digital consultation as well, for instance. How's the face of the hospital space changing now?
So I think digital is a big play, which for a long period of time has evaded Indian healthcare. And basically because, we also did not have good clarity from the government in terms of how digital consultation, the ongoing consumer, doctor, hospital interactions in the digital world will take place. Just as COVID hit, there was a massive reform exercise that happened, and we got a new regulation out, which actually created the path for this massive scale of digitization in healthcare, which is taking place right now. So effectively, I think the digital impact on healthcare is one of the most powerful tools that have got created in India over the last 2 years now. And, now also look back and see from between 2016 and now, Indian healthcare has taken, or the digital side of Indian healthcare has got funded to about $4.4 billion. Last year itself, the health tech side got funded by about $1.9 billion, which is number 4 in the world. So when you start in the top 3 countries, it is United States, it is UK, it is India, and then you suddenly talk about the fact that the kind of investment that has happened in the Indian health tech space is right next to China. which effectively means that, health tech is becoming a very big foray from a commercialization perspective in India. In our own businesses at Asia Healthcare Holdings, as you know that we are in the single specialty space, we have seen digital being a massive impact in terms of what we are doing in the mother and child space today, whether it is on the motherhood side, which is our hospital chain, or on the IVF side, which is Nova IVF. So I see the digital impact of healthcare becoming omnipresent across the Indian healthcare ecosystem, and that is very, very powerful.
Hi Vishal, good morning. This is Nayantara. Now Vishal Bali was of course, the chief at Walcott Hospitals. Now you seeing him head this TPG Growth Healthcare Specialty Company. So tell me a little bit more. You just touched upon deal making. We've seen a lot of deal making, particularly in the diagnostics space. E-pharmacies has become a buzzword as well, whether it is Apollo, which is ramping it up, Max Healthcare seems to have plans. You've seen consolidation being led by the likes of Amazon as well as Tata's too. How are you assessing this space?
Yeah, so I think, e-pharmacy started many years back, and that was the first foray of the so-called e-commerce on the healthcare side. Which was basically, selling medicines at home to people, which got now translated again, because there was a lot of regulatory haze around the entire e-pharmacy businesses for a long period of time. The clarity again was not there. Ever since the time, the clarity has come in terms of the opportunity that we see around, home as the first destination of care. There is a lot of change which has come about, and that's the reason why you're now finding almost every large house wanting to get into the digital healthcare play. Now, this digital healthcare play can start with the e-pharmacies, will get rolled up into other healthcare services. We are already talking about a lot of the companies wanting to do home diagnostics, particularly pathology diagnostics. Home healthcare as a service is beginning to take a big shape because, again, the consumer wants services to be offered in their homes. So the ecosystem is getting redefined. And the ecosystem is getting redefined not just by capital which is coming in from large corporates, but also capital which is coming in as growth from the growth providers or from the growth capital perspective. And even from the way that the strategics are now looking at it in terms of the large scale acquisitions. So I think there is a multi-pronged activity which is happening over here. Again, very powerful from the consumer perspective and very powerful from the Indian consumer perspective, because we should keep in mind that there are going to be 900 million Indians who are going to have access to the internet. And on that pipe, a lot of healthcare can roll. So great opportunity.
Now, COVID-19, of course, exposed the lack of health infrastructure. It has got the largest industrial houses enthused. Now, you're part of the TPG Growth Fund, right, with this Asia Health, with the new company, AHH. So give us an idea as far as capital allocation goes. Give us an idea from a private equity perspective as well, how they're looking at this space in India.
Yeah, so I think the capital allocation for healthcare has been a very dominant part, particularly in the Indian healthcare ecosystem, for a very, very long period of time. So the Indian healthcare delivery side between hospitals and diagnostics has taken up more than about $6 billion of private equity capital, right? And now, as we were talking, that the health tech side has already taken about $4.5 billion of capital. So I think it's a great situation that is emerging between the physical healthcare side, which is on the delivery side, which is giving rise to better quality of infrastructure, the single specialty hospital chains, which are now becoming a new flavor of the day, basically because low capex, but high impact and high opportunity to sort of create a larger network in a short period of time. And then simultaneously, looking at the health tech opportunity and trying to see as to how the both online and offline healthcare delivery can take place in the physical world and in the online world. So I think the capital that you are now seeing coming inside this sector, all these years has been backing the delivery side, which is the physical healthcare infrastructure side, and now you're seeing a great amount of capital now going behind the health tech online side.
Okay, great to have those insights. Now you know why this TPG Growth Fund company is betting on single specialty over multi-specialty, the views when it comes to diagnostics, and of course capital allocation that we're seeing as far as the healthcare sector goes. Always a pleasure talking to you. We've of course seen a comeback of the diagnostic stocks and the hospital stocks in the last couple of trading sessions.